Hi everyone, welcome to Acupuncture 123 Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now today I'm going to talk about what yesterday we actually talked about how to use acupuncture and acupressure to treat prostate enlargement, right? We talk about the symptoms, right? Then today I'm going to show you how scalp acupuncture and balance method acupuncture that combine together to treat prostate enlargement issues, right? Now I've got some small needle today. So if you're treating this issue, this is just one of the strategy and it will work for you, right? So if it doesn't work, we have other strategy, okay? This is just one, okay? Now we for the scalp acupuncture, we can do scalp acupuncture and Dr. Tan's scalp acupuncture. Okay, now this is the area that I want to show you. That let me get. So we know that we talk about prostate enlargement and the older men that get it, right? They suffer from it. So think about it. As we're getting older, our organs are actually function lower, right? It go downhill. Right? I don't think anyone would say, "Wow, as I'm getting older and my organs are working better and stronger." No one would say that, right? No one would say that. So we know that prostate enlargement is on the elderly patient that happen more. So we know this. If you want to get this treatment done, and with scalp acupuncture, then I would suggest you treat all the organs, which means upper jaw, middle jaw, and lower jaw. All right. Now this is the idea for you, but I'm not gonna needle myself that much of needle today. But I'm gonna let you know that you must needle lower jaw. Why is that? Because kidney bladder on lower jaw. All right. Now let's talk about here. Bai Hui, we show you about Bai Hui of Bagua 8 needles, right? It can bring all organ, can treat all organs, right? You can do that strategy if you wanted to, but otherwise we just do Bai Hui over here, 3 needle over here, and a bit in front over here is lower jaw. All right. Now we're gonna do those needles. All right. Bai Hui. So I should get tendinous spot. Now, normally you need to from Bai Hui to meridian aside to bladder meridian, right? But in this case, I would like to do it, go to GB meridian, gallbladder meridian. The reasons that is because I found if you just go to UB, you may not get any ulcer point, but if you go extend to GB, if you get the ulcer point, and it work very well as well. Okay. So right, we extend to. I don't find any point. I don't find any point at all. So no tendinous spot. If there's no tendinous spot, don't worry. Just go to do Bai Hui, which is 220. And with 220, you want to get what? You want to go sideways and that sideways and in the middle, which is cover the area, okay, rather than just straight one needle. Okay, you want to cover the area. So 3 different direction. If you've been following my video and you know what I mean, right? So I probably have to show you again what I mean. So let's say the Bai Hui area, VPF area is that area, okay, on top of the head. If that is the big area over there, which is over there, then you're gonna put needle like this, sideways, and here. Okay, instead of just one needle, one dot in there, right? So the reason we put sideways, and then put in there is we cover all, we try to cover all the image, all the map, right? So if you're on this live video right now, please give me a thumbs up. Give me a thumbs up and say hello to me and let me know whether you're an acupuncturist or not an acupuncturist. If you are acupuncturist, please reply 1 and let me know where you come from. If you're not an acupuncturist, reply 2 and let me know where you come from. So I want to know my my audience, whether you're an acupuncturist or you're not an acupuncturist, and that would help me understand my audience. All right, thank you very much. Hi, Miles. How are you? From Philippines. Yeah, I've been knowing you for a long time, right? Great. And how about on YouTube? There are a lot of people on YouTube. All right. So, hi, Boyan. How are you? So I did that on yesterday in Chinese version as well. So we're gonna do on, about 0.5 or 1 chun lateral to the needle that I just put in. Again, I would do 3 different directions. So I'm going to do that direction first. Then I'm going to do that direction. And straight to the back, right? That is VPF. Boyan from Malaysia. Okay, that's another one. 3 direction. Okay, I got 3 needle over here. First, we're gonna needle what? We're gonna needle the lower jaw, and lower jaw is just about 1 chun or 1.5 chun, and in front, like forward to the Bai Hui area. So again, I'm gonna try to get 20 point. If I get 20 point, I'm gonna needle the 20 point, right? Let's go. Don't get anything in here. Let's try it here. Oh, I do get 1 point here. I'm a bit sensitive. So that is about, again, 3 finger in front of Bai Hui. I'm gonna put this one in. Oh, that's very, very sensitive. So if I hit the pain, I don't keep going. I stop and pull out a little bit and change the direction and keep going. All right. So this is how it can be painful if you needle, even just a small needle on the scalp, or it can be painful, right? So just be very careful when you hit. Be slow, and when you hit the pain, if the patient feel pain, or you should try yourself. If you felt the pain, then stop it and pull the needle out a little bit and change the direction and keep going, and therefore you avoid the pain. And I don't like giving patient pain from the needles, to be honest. I should have another point over here. It seems like that is not, yeah, a little bit in here, so a bit painful over here. So thinner spot, and that could be, I will count it as lower jaw as well. Again, I do 3 direction, 1 over there, 1 over there, and 1 over there. Try to cover as much as I could for the map. So if you cover the map better, it will work better. Okay, right. That's just example. Again, I could put more needle if I wanted to. All right. So another one is when it comes to Dr. Tan's balance method acupuncture, and the lower jaw is actually on the back over here, which is Phua phone Fu. I don't know what phone Fu number is. Let me check out for you. Phone Fu. The English code of phone Fu. I'm pretty sure I have it somewhere here. All right. Do meridian. Phone Fu. I know you have some question over there. Yeah, phone Fu is 216, right? So why you want to go to 216 phone Fu? Because phone Fu is the lowest point on the behind your scalp over here, right? So because where is the prostate? Prostate is actually on this level, right? Lower than your tailbone. So it's about on this level. So the lowest level on Hui Ying, around Hui Ying. So you want to find point, point around here on the bone or on the phone Fu or level with phone Fu, which is 216, right? We just call it, 216, or above, a little bit above, right? So which means is over here, over this point, and go back a little bit and find, okay, I have some tenderness spot over here, so I can needle here. Those 2 points quite tender. Yeah, not as bad over here. So I can needle there. Oh, that is very, very sensitive. It actually gets sensation down to the neck area. So again, feel different direction, but gentle, not getting the direction going there first. Then pull out a little bit and go to that side. To that side and go straight down. That's it. Simple. Now, with exercise would be better. Okay, a round of needles, actually, the little needles. Okay, I'm pretty sure I got some other needle over here. Yep, I got more needle over here. So I can do this needle. Feel direction. Yep, 3 different direction. Zhanzhu point. Both of them are good for prostate as well. So needle over here, Zhanzhu. Okay, let's find out what Zhanzhu means. The code number of Zhanzhu. Zhanzhu would be UB meridian. Let's go have a look. Zhanzhu is UB2. UB2, that over here. It's good for prostate. But to be honest, if you want to get to the point, you know, sometimes just putting 1 point is not good enough. You know, just go ahead and get where there's any tenderness spot. If you get 1 tenderness spot, you can cover the area 3 different direction, or go to the middle a little bit. Why that is, you want to know the structure of prostate, right? So don't just put over here those 2, because it can be in the middle that it can treat prostate as well. So go ahead for palpitate over here. My one's more sensitive in here, and sensitive in here as well, and actually also sensitive over here. So you may be able to put 2 needle over here, you know, or 2 needle, 1 needle goes 2 points or that direction, and it's up to you, and that all work. It will work for you. Okay. Hi Chirag, how are you? Let's see some questions. I'm going to show you some exercise as well. Okay, the exercise that I normally ask my patient to do while the acupuncture, and as well as when they go home, and before pee or before bowel motion, they have to do the exercise, and afterward as well. All right. Please, what are you? treating. I'm treating prostate. Not that I have prostate issues, but I'm showing how you can treat it. Okay, I'm going to show you on hand how needle hand over here. Then you can treat it too. All right. Let's have a look. What's your question? What disease that can be treated in in lower, middle, and upper jaw in scalp acupuncture? Okay, Carl's a good question. What disease that can be treated in needling lower, middle, and upper jaw? All disease. Why is it? Because upper, middle, lower jaw, all organs in here. So if you know how to diagnose organs issues, then you can treat upper, middle, and lower jaw. Put all needle, cover all the organs. That is how it works. And again, remember in the last few video we talked about on VPF, on Bai Hui, we put 8 needles to treat what? To treat all organs as well. 8 needles. Check out the other video that I have done before. How to locate the exact location of lower, middle, and lower jaw. Good question. But I would suggest you go to Dr. Ju's website and buy his book, and then you'll be able to know how exactly. For me, I don't actually go exactly because it's just an area. So just the quicker part for me to do it is Bai Hui and here. Then you can go 3 directions, three part, and lower, middle, and upper. That's it. This is the quicker way I do it. Okay, I don't actually exactly follow Dr. Chu's map exactly. I just go portion approximately, and that's good enough. Hi Karuna, how are you? Hi Eric, how are you? I have some question on YouTube as well. Hello sir, from UK, please can you give a simple explanation for best sciatic healing? I've seen a few different techniques. That best one appear to be naval acupuncture. I will tell you, I know naval acupuncture. There's no best thing that for sciatic healing, because it really need to come to diagnose properly and to treat it properly and to see whether there's organs imbalance or not. Because by using some of you need herbs and need structure acupuncture and organs to balance the organs, and some of them is quite easy. If you're looking for acupressure point, you can check on the YouTube, my YouTube. I've done the YouTube video for acupressure point for sciatic pain already, right? You check on those video. One from London, Denmark, practicing micro system acupuncture. Thank you. Very good classes. Thank you very much. If there is no sensitive around the navel, then which other points should be checked instead? Also, an acupressure point a good addition. Yeah. Again, go to my video. I have a few videos talk about sciatic pain, and I've shown you a few different points instead of navel acupuncture on the navel. All right. Thank you very much. All right. Let's say we put needle in, right? I just a few examples for you. And what is the best exercise for prostate enlargement, right? I don't know whether you, let's talk about this, how I explain to my patient, right? And teach them how to do the exercise, okay? And a few exercises. We all can do it, we all can do it, but you have to explain in a way that patient can understand. If you don't explain in a way that patient can understand this, there's no point, Yes, we're gonna do pelvic contraction, but how do you do that? You can't go and check, you can't show your patient, but you need to explain it very well in this way. That's how I do it. Okay, I ask my patient, when you go to toilet, for urinate, you go and then you stop it. You suddenly stop your urine. We can control, right? You stop, you contract and you stop. Have you ever had this experience? I said yes. then you know. And this is in the front part, you contract, you know. Then think about if you go for bowel motion, you contract it, you stop for bowel motion, you contract, that is more in the back, right? So now I want you to do both together, because what we do is we want the patient to do hui in contraction in the middle, right? In the middle, right? But it's difficult to say you just do it in the middle. But if you do the front and the back at the same time together, so you can do it right now, you know. If you just do it in the front, and you know less contraction in the back. If you just do in the back side, you know, oh, less contraction in the front. If you do it together, it's totally different feeling. Okay, that I want you to do that. All right. So this is just the first part. So contraction, it can be just contraction from the side to the middle, right? From the side to the middle. But that's just the first part. All right. Secondly, you want the patient to think about contraction from the side and bring it up. Bring it up. Like, think about here. Bring it up to here. So contraction up. It's different feeling. Yeah, try it. Just contract. But if you contract and up, contraction and up, and that's different feeling. So I normally needle my patient and ask them to do it about 9 times. Contraction up, contraction, continuing for 9 times. Then have a rest for 3 to 5 minutes and start it again, repeat it again. So this will help the patient get result, even better results. Okay, this is the first one. So what can they do at home? I suggest my patient to do it in the morning with this exercise and before bed. And apart from that, you want them to do more. And how to do more? Okay, my master taught me, whenever they go to the toilet for urine or bowel motion, before urine or bowel motion, if they can do it for nighttime first. Then try to pass urine. And after they pass urine, finish, they do it again. All right. So before and after, that is what I would suggest. Okay. And apart from that, from the scalp acupuncture, another strategy that I would like to add on in general, sometimes I don't even use scalp, I just use the needle that I just show you the other night. Was it yesterday, last night? I can't even remember when did I show you. Was it last night or the night before? Okay, those two, go and check it, the acupressure point. So you're gonna do needle from here to here, right? Like we talk about the 3 meridian that you're gonna do is in here, large intestine 1, 2, 3, 4, and 5, and Sanjiao 1, 2, 3, 4, and small intestine 1, 2, 3, 4, 5. All this needle, any point from here down to your fingers, you want needle. And I'm gonna show you how to needle Jingwao Pai, because Jingwao Pai is the worst one. The worst one is the most painful one and most difficult to needle one. Okay, I mean, thank you. Yes, last night, wasn't it? Yeah, I did some more needle video today, and I did wuyunliuqi video today as well, recording. So too much thing going on, so I forgot about when did I actually do it. But thank you very much. So I'm going to show you on YouTube, okay, how to needle this. Okay, get me needle very on this large intestine 1. It doesn't need to be painful. You know, you don't have to create any pain at all. Right? It's so simple. It's so easy. Okay, you just need a very superficial under skin a little bit. You don't have to perpendicular to the skin. Okay, don't do that because it's so painful. All right, this is how I do it. You see, the needle's on. There's no pain at all. Right? I'm gonna show you on Facebook much closer. Okay, here you go. I hope you can see it. Okay, put it on the skin a little bit. And here you go. And even though you see the needles go out to the other side, here you go. You see, there's no pain at all, right? On Instagram, you know. I take it out already, so I'm going to do it again. Yeah. Ooh, I can't see it. Okay, here you go. Instagram. Here you go. Simple, right? That's what third time that I did it now. Just showing you. Okay, I'm going to do it on YouTube because YouTube people need to. So I'm going to do it in here like this. There you go. You see, the needle can go to the other side, and it won't fall. The needle is still there. All right. You don't have to go through the skin, but I can go through the skin, just a little bit of skin, and make it stay there, and that's it. Right? Very simple. So you put all the needles. This is just one of the strategies. You can put 3 yang meridian from wrist down to the hand, to the fingers, and you can put the other side 3 in meridian from here to here. Okay, how are you gonna check out? Normally I needle patient 3 times and ask them to do all the exercise. After 3 treatment, if they don't get any response, I'm not saying that this is going to fix everyone, no. Some people, you have to directly treat the organs, all the organs. If they don't respond for that, what would I do? But you find a lot of people respond to this. You find a lot of people would respond to this if they do it properly. If you needle properly, it will respond. If it doesn't respond with that, I'm going to change the strategy to pulse and to treat the organs directly, to change the pulse, to balance the pulse, to treat the organs. Just like all my live video Monday, I mainly use Magical 12 and do iron triangle to treat the organs. Okay, this the main treatment that I do, because I deeply believe that fixing the organs, balance the organs, it will work even better. Okay, so another thing that I want to share with you is I have a patient yesterday. I in the coughing webinar a few nights ago. Then what I talk about 五运六气, right? 5运6气, and it's so simple that I just found out that 5运6气 10 years ago, more than 10 years ago, I started 5运6气, and it didn't make sense for me. I calculated and say, way back there, I mainly I collect the information to make the diagnose. So I collect the information by asking the patient. So which we most do, and then I make the diagnose on that way, and then I calculate 5运6气, and it was difficult for me because I found that 5运6气 diagnose doesn't match what I was diagnosed by doing, by asking the question and collecting information from patient. So I dropped 5运6气. Since the last, I think 3 or 4 years, maybe 3 or 4 years, or even 5 years now, I can't remember. I started to use pulse to diagnose, and I completely changed my the way that I treat patient, and the way that I sorry, there's someone, Acupuncture 33 sent a request to be in your live video. Of course, you can view it. Can you view it? Okay. Now, so I use many pulse, all right, pulse diagnose, and that changed my practice a lot. And I use the herbs just a little bit, just using tea bag, and I use the acupuncture and Chinese herbs, just follow only pulse. But since the New Zealand lockdown time, I can't see patient, and I can't take the pulse. And even though my patient, we do video consultation online, and there's no way for me to take their pulse. And what did I do? I actually get back. I was lucky that a few months ago I started 5运6气 again, and Then since the lockdown time, I use uyunliuqi to diagnose, and guess what? I found out that the uyunliuqi diagnose same as the diagnose of my post. I check previous cases, few of them. I bring it all up and I check it all. Oh, God, all match. Just about all cases match uyunliuqi diagnose, and that's why how they work very well. Way back 10 years ago, when I checked my diagnosis with uyunliuqi diagnose, it didn't match. That's why I dropped it. But now it actually matches. Then yesterday, I have a patient who called up and had diarrhea, had sore throat. Hey, sore throat, heat symptom, right? Swelling gum, heat symptom, right? Well, I make it so simple. And she got vomiting and diarrhea as well. I make it so simple. I just got out uyunliuqi. Of course, I asked all the questions. I put it down and I make diagnose according to the answer I received from her. Then I get uyunliuqi out, and guess what? The uyunliuqi said the diagnosis would be the cold symptom and the kidney access, which is too strong, and the wound too strong. So what I did is I actually didn't give herbs or diagnose according to the information that I collect from her. I actually prescribe the herbs according to uyunliuqi. So we talk about the diagnosis was water too strong and wood too strong, right? So water and wood, we reduce those two. So I give herbs, reduce those two, and as well as improve, tonify earth. Why do I tonify earth? Because when I tonify earth, when the earth is strong, the earth is gonna against water, right? Simple. Now, when the earth and wood, so I'm gonna explain again. The diagnose is water strong and wood strong. So we want to reduce water and reduce wood, right? That is the principle. Now, by reducing water and wood, we can improve, which tonify earth. Why do I tonify earth? Because when I tonify earth against water. So water will get even lower, weaker, right? That's number one. Then we know wood against earth, right? If earth gets stronger, and earth will do the opposite, force wood to get lower, to weaker, to get wood to get weaker, right? So that is why I do, this is what I call iron triangle of 5 elements, right? So I did 6 herbs according to that. Give it to that and send it to her home, her house, and she took it yesterday and took it today. I get 7 days, only two days of herbs, or 1.5 days probably. She got much better. But think about it. She got what? Sore throat, sweating arm, and dry cough. Dry cough. We would think about diarrhea, dry cough, and a fever, and that would be COVID-19. They were so scared like maybe COVID-19, and of course she hasn't been to the doctor yet. I don't know why. It's none of my. I didn't make the call, and I just give her the herbs, and she got much better today. This is according to uyunliuqi. If I took the post, I'm pretty sure I will get the same diagnosis because I've been testing uyunliuqi on my previous case and figured out that uyunliuqi diagnosis is actually same as the my post diagnosis. Then that made me very exciting, which means I can now just do distal consultation, that I can just do wuyunliuqi without taking any pose, without asking any question. Of course, I would ask question as well, but I really don't have to depend on the information that from patients feedback to me. I know the diagnose. I can make the diagnose much easier right now. So this is my a bit of exciting thing for me today to share with you. All right, we've got some question over here. Aside from navel and Baihui area, what part of the body that can be needle with Bagua needle insertion technique? There's a lot. Jiwei, any point can do that. Any point can do that. That's easy. That's easy. Post-diagnose. I don't teach post-diagnose at the moment. If you attend to my workshop, I'll teach you. Or only teach on my workshop at the moment, not online yet. I've watched your acupressure on near the shoulder blade. Is that the one you suggest? Yes, that's the one I suggest. Thank you so much for answering my question. How treat right hemiplegia? Basically, how improve hand motor movement. All right, that's for stroke patient. That is not that easy, but I have talked about it in the past. Okay, we'll make that video for you. I've talked a lot in Chinese platform about how to treat paralyzed patient, all this thing, but we'll talk about another day. Okay, when treating with acupressure near the shoulder blade, is it on the same side as the sciatic pain or on the opposite side? Either side will work. Either side. Normally we do the opposite side first. All right. Okay, give me the link. What link do you want? Amina, what link do you want? Oh, are you saying that? No, we got some free video that talking about the post-diagnose that you can watch. That is actually in English, and I have some paid. You have to pay for a webinar. That's a very basic one for local balance. Then I'll post it to you if you wanted to. Right. That's it for tonight, and I'm ready to go to bed. Right. Thank you very much. And yeah, I'm gonna take out the needles over here. Right. And I'm going to film some video like the workshop. I haven't got the workshop date yet because I was organizing the workshop in Australia. We just finished one in Auckland, and I have one in Malaysia, Taiwan, and Australia. Okay, but I haven't actually exactly booked the date yet because we have to change the date right now due to coronavirus, right? But yeah, I'll post it out on our group as well. If you're on our group and this page, I'll post it out if we get a final date for that, right? Thank you very much, Amina. Aminda, not na. Thank you very much. That's it for today, and I'll see you tomorrow on my live video for acupressure point in acupuncture. And please do let me know what do you want me to talk about. I put all your question, your requirement in a note, and I'll come to those things. Okay, so don't you worry. You just give me your requirement, and I will one day I'll do it for you. Okay, I've got a lot of waiting list in my notes. And yes, please do share the video so more and more people will join us in the live video, because I need more supporter. If I don't have audience, I will stop doing this live video. That's why I ask you to share to your colleagues, share to your family and your friends, so they can join in to this live webinar. So I have more reason to do this for you guys. If there is no audience, I will stop it. Okay, well, thank you very much for your supporting, for your time being here today. So I love you all. Stay awesome. Bye-bye. Oop, I haven't finished that one yet.